Hi there, Dr. Scott Kilberg, the Video Foot Doc, here with another video for you on all things foot and ankle. Today I'd like to talk again about heel pain because that is one of the most asked questions when people visit my office. And it also seems to be a very popular topic regarding people who are reading my blogs and other articles and things that I've submitted regarding foot and ankle information. Heel pain is probably one of the most common causes or common areas where the foot can become painful, and certainly one of the most common conditions that I treat in my office. It has to be understood that heel pain really does need to be addressed in a fairly specific way in order for the pain to be properly treated so that the pain can go away on a long-term basis. Otherwise, if it is only sort of partially treated or all the components of pain aren't addressed at the same time, then heel pain will just simply return after a brief period of being resolved. Now, to be very specific, I'm going to be speaking about plantar fasciitis because that by far away is the most common cause of heel pain. There are other things that can cause heel pain, but these are far less common. So for the sake of this discussion, it's going to primarily be related to plantar fasciitis, which is really indeed the most common cause of heel pain around. Proper treatment of plantar fasciitis involves addressing the two components that actually are part of this pain condition. The first component is the actual inflammation of the plantar fascia itself. Now, just to recap, the plantar fascia is a ligament, basically a broad band of tissue that actually has three separate bands that attach to the heel bone and go all the way to basically the ball of the foot and kind of act as sort of a structural stabilizer to the bottom of the foot. It keeps a lot of the internal musculature within the confines of the bottom of the foot and has several other different support roles. Due to a fairly limited number of different reasons, the plantar fascia can become irritated. Now, by far and away, the most common reason is people who have flat feet. That causes pain, that causes strain and irritation to the plantar fascia over a long period of time as the foot flattens during walking and standing, and that eventually causes the inflammation to occur. People with high arches can get the same thing because of poor shock absorption as seen in high arches, and other people can sometimes simply just injure the plantar fascia due to stepping on something that causes bruising or strain and irritation to the fibers, or by having an injury such as a rupture during a athletic event, or another injury by going up and down ladders or stairs frequently, which causes stress and strain to the fibers as well. So those are basically the recap of the causes of plantar fasciitis. But addressing the actual condition requires getting rid of the inflammation, which is the real source of the pain, and it also involves addressing the underlying root cause. Getting rid of the inflammation is something that is sometimes difficult to do in certain cases, but most cases, not all, but most cases respond to a fairly short number of things. These include stretching, which helps to make the plantar fascia more limber so it doesn't become as inflamed as one goes through the normal course of walking and standing all day. Icing, which helps to reduce inflammation and also can form a sort of massage if done properly by using like a frozen water bottle or other cold object that is round in shape. Anti-inflammatory medications such as ibuprofen or prescription variations, if those are appropriate for medical use, are very helpful in reducing the body's overall state of inflammation, which helps to reduce the actual direct local inflammation at the plantar fascia. And finally, many practices, including myself, employ the use of an injection of a corticosteroid, which is basically a chemical compound that acts to reduce the chemical factors that begin the inflammatory process in the first place. And when injected into the heel, that can help to directly reduce the inflammation at the spot of inflammation, which is the plantar fascia. And that also affects the inflammation of any surrounding nerve tissue and affects the whole area in general. Now, steroid injections are an important part of many people's treatment. Not all physicians utilize them. I happen to think that they work quite well for my patients and have pretty good success with using them in a short course. But the use of the steroid injection really does need to be done on a fairly close time frame. Some people will inject the heel once and then not worry about it or address it again until many months later. The problem with that is that you kind of tend to lose the additive effect of the anti-inflammatory process of the medication. In my practice, I find that injecting the heel on a 2-week basis, once every 2 weeks, up to approximately 3 injections, seems to work the best for the vast majority of my patients. I never go more than 3, and there's not really a magic rule about how many you can really give. There's not really a strong scientific study that says, you know, such and such a number of medications you can have per year. But really the fact of the matter is that if you inject too many of the injections of a corticosteroid, which is essentially usually in crystal form, those crystals can build up within the tissue. And if you're injecting a large number of crystals into the heel tissue, that will eventually create their own amount of irritation and inflammation and can cause other problems in other areas of pain. So the injection course, split apart by a couple of weeks, not several months, but a couple of weeks, seems to have more of an additive effect. And on average, most of my patients, somewhere in a range of about 2 injections, are usually pain-free. Not everybody, but quite a number of them are usually pain-free. As I said, I don't give any more than 3 in general during a very quick time succession every 2 weeks for the reasons that I mentioned before. So those measures, along with a couple other potential treatment measures, including the use of something called a night splint, and there are a few other types of therapies that kind of go along with this, can help to reduce the inflammation. That addresses one side of what plantar fasciitis is really about. The other side is controlling the underlying problem, which is the foot structure. If you don't control the underlying problem, which in the majority of the time is the structure of the foot, plantar fasciitis, even if you get rid of it with anti-inflammatory measures, is going to come back. And so in order to reduce that, you have to control the problem that occurred in the first place. For people with flat feet, which is the majority of reasons why people develop plantar fasciitis, structural support with some type of insert that's going to be supportive and stabilizing the arch, either good over-the-counter insert or a prescription orthotic insert, will be helpful in allowing the arch structure to become much more stable, which will reduce the strain to the plantar fascia. Now, shoes play a role in this as well, and if you have a flat foot, you really do need to be in a shoe that is much more stable and not as flexible, which allows the foot to decrease the strain, or allows the strain to be decreased in the walking cycle, so that the plantar fascia is sort of doubly protected. The insert stabilizes the arch structure directly, and then the shoe, if it's supportive enough and stable enough and not too flexible or too unstable, will allow the orthotic and the foot to work together so that there's less instability with walking, and therefore there's less strain to the plantar fascia. Now, for those who have high arched foot structures, a shoe that is padded and will absorb shock, along with an insert that's well padded that absorbs shock, will help the most with plantar fasciitis, sort of the opposite of those who have a flatter foot structure. For those that have sustained plantar fasciitis due to an injury or some other type of problem, such as frequent ladder use, control of those types of activities, and usually simply rest and anti-inflammatory therapy is often sufficient to relieve the plantar fasciitis. But these are not necessarily the most frequent causes of plantar fasciitis, and so structural support, either for flat feet or for high arches, is usually going to be necessary for those who are dealing with plantar fasciitis. When those two things are combined, the actual condition itself can be fully relieved, and the plantar fasciitis can be maintained in such a way that the inflammation will be reduced, and the likelihood that plantar fasciitis will return again is pretty limited. Well, I hope you enjoyed this video. Please look for more video on all things foot and ankle on this site as well as others, or you may check out my website at www.inpodiatrygroup.com. Thank you.